Hello everyone, this is TYates and my final presentation for HCM 830 Health Economics, Resources, and Finance. My chosen topic is the application of blockchain technology to fight fraud, waste, and abuse in healthcare, which intersects perfectly with the course topic. I chose this topic because fraud, waste, and abuse are rampant in the US and abroad. There are two missing elements in the finance system: veracity or truthfulness and trust. Now, a new technology in the form of mixing some older technologies is called blockchain, and some refer to it as, quote, a game changer for what it can do. Blockchain records transactions into blocks and then ties those blocks together using a chain of hashes. A hashing algorithm, explained in the terms section lower left, will always produce the exact same hash given the same input. If you change as much as a single period in the hash of a 1,000-page document, the resulting hash is vastly different. This is what gives blockchain immutability. In frauds where a provider may bill for services never rendered, or they upcode or bill for unnecessary labs or other tests just to induce insurance payments, immutability can stop those frauds in their tracks. When providers know they can't go back and meddle with records, it makes sense that they cease the cheating. With some claiming that the existing fraud, waste, and abuse may collapse the healthcare system altogether due to the astronomical rises over the past 10 to 12 years of 60% per capita, cutting out the billions lost to fraud, waste, and abuse is absolutely essential. Now, if we look at the literature and research on the matter, so fraud is quite often difficult to detect. However, there is a proactive effort to prevent it, or when there is a proactive effort to prevent it, we do see results, such as a Chilean program that saved 9.5% of total costs. The current methods where providers are paid and then auditors chase is highly ineffective. The proposed study will use a Medicare HMO in Phoenix, Arizona, which sparks our first research question. At what level of proficiency will post-care Medicare members be able to leverage a blockchain solution to impact the levels of fraud, waste, and abuse in a primary care setting? The next two questions are directed at the providers themselves. How will providers react to a blockchain monitoring solution of their submitted claims? Now, this question has to do with the actions such as data hoarding and patient involvement in their own care. And the last question, how will a blockchain application affect the amount and number of per-member claims in an experimental group? This question is the true crux of the study and will be answered by statistical analysis of claims data. To get answers to these questions, a mixed methods study with an experimental design will be conducted. The participants will be divided into two groups noted as A and B. Claims activity for both groups will be baselined for 6 months. At the 6-month point, Group A will be provided a mobile app tied to a private blockchain that records claims activity. When a claim is submitted with them as the subject, the mobile app will notify them. They can dismiss the notification with no action, or they can flag the claim if it seems suspicious. Providers for Group A participants will be notified that some anonymous patients of theirs may be participating in the program. Claims activity for Group A will be measured both pre- and post-application and analyzed for statistical differences. Group B is the control group and will not receive a mobile application, but are there to account for anomalies such as a flu epidemic, for example. Since the study will measure provider behavior based on their patient populations, any patients that see a doctor that serves both the A and B groups will have their data excluded from the study. The qualitative part of the mixed methods study will consist of a survey of nurses in the provider's offices and will measure clinician attitudes toward the program and any noticeable changes in provider behavior. The hypothesis for this study is that fraudulent providers will change their behavior in a measurable way once they are made aware of the blockchain application program. Honest providers will likely shrug off the program as it should have no effect on their medical practice. The immutability of the claims transactions on the blockchain will prove beyond a doubt that dishonest providers will suffer consequences, and payers, whether government, private insurance, or individuals, will save billions. Thank you for listening.